Happy holidays! Thank you for joining us live. I'm your host today, Rachel Sullivan, for your CoolSculpting segment, and I'm here with Dr. Mary Lupo. Thank you for having us. Yeah. So Dr. Lupo is a board-certified dermatologist, and she is a clinical professor of dermatology at Tulane University of Medicine. So we're here at the beautiful Lupo Center. This is very exciting. So now, Dr. Lupo, you've been at the forefront of non-surgical skin rejuvenation for over 30 years. You clearly started when you were a baby.
Yeah.
So patients travel from everywhere to gain some of your insight and expertise in a myriad of treatments. I heard a quote earlier, body by Dr. Lupo. So count me in, maybe we can chat later. So of all the non-invasive and non-surgical procedures out there, why did you choose CoolSculpting?
Well, for me as a dermatologist, it's very important that I see the science. I want to have something that has clinical efficacy that we know works, but I also need something that has a good safety profile and a good patient tolerance profile. I don't want something that's too painful.
Absolutely.
So CoolSculpting fit all the bills. The science is there, the long-term efficacy is there, the patient safety, the data is there. So I felt very comfortable. And with all choices for products and for devices in my office, patient effectiveness, patient results, patient safety are always at my front of my concern.
Wow. So science, safety, and really overall comfort are really your most important concerns.
We want it to work, we want it to be safe, and we want patients to be able to tolerate it.
Yeah, beautiful. So if that's piqued your interest, all you listeners out there, please begin to submit some of your questions. And our specialists are online right now, ready to answer all the questions you might have. First, let's take a quick poll. So for those of you watching out there, if you're interested in learning a little bit more about CoolSculpting as a treatment, post a snowflake in your comment. Ooh, I see some out there. Thanks for posting. And better yet, if you're interested in seeing a live CoolSculpting treatment, let me see some blue hearts. Okay, it looks like we have a lot of interest out there, so thank you very much. Okay, so Dr. Lupo, let's meet our first patient. So this is Corinne.
Hi.
Nice to meet you. And we have our nurse, Stephanie. Wonderful. So what we're about to see is the first stage of really starting your CoolSculpting treatment. And it first has to start with what I understand is an assessment. So can you walk us through what happens during an assessment and why is that so important?
Well, just as when we see a patient's face for the first time who wants rejuvenation, when someone wants body sculpting, we have to do a full assessment to see where are the pockets of major concern, but where are those other areas that might also be impacting the shape and the figure, and patients don't realize how it all fits together.
Yeah.
So we really need to kind of show the patient where their areas of need. We, of course, always start with what's bothering the patient the most, but we like to give a global plan, if you will, for a long-term result where we really get to the patient where they want to be at the end.
Beautiful. So Corinne, what brings you in today? What area are you focusing on?
Well, as you can see here, I've got a little pooch. But my situation is I've been an athlete all my life. I've worked out, and I was gorgeous. But now I'm in my 60s.
You're still gorgeous.
I was going to say, let's not.
Well, thank you.
Still gorgeous.
Oh, bless your heart. But I'm in my 60s now, and I find that no matter how hard I exercise, I just can't seem to get it all. And I'm just so happy that we now have the non-invasive procedures because I don't want to get liposuction, but this is something I can do safely. And by the end of the holiday seasons, by January, I'll be going on vacation.
So she's a perfect candidate because she does work out. She is fit. She is not using this procedure as a weight loss technique. She's using it for a body sculpting, to get rid of those stubborn areas that no matter how much you exercise, you're not going to get rid of.
That's right.
And, you know, a lot of people don't want liposuction. They don't want those tight garments afterwards. They don't want the risk of all the anesthesia that's required. And this is a perfect candidate. She's motivated, she's taking care of herself, and she's just turning to us for that little bit of help to get her to her goal that she can't quite achieve on her own.
Beautiful. Well, those seem like realistic goals to me. So, Stephanie, what happens now? So you're going to assess her abdomen.
First, what I do is just wipe with alcohol, and that's going to take any excess oils off the skin.
Okay.
And this is important for the preparation of the skin. And I'm so fortunate to have Stephanie. Stephanie is an RN, but she is our dedicated CoolSculpting specialist. So she does this all day long, and it really helps. And we work together, especially with new patients. We talked before I sent you down to Stephanie, so she kind of has an idea of what the plan is.
Right. Wonderful.
And then first I identify, we're doing her lower abdomen, and you identify the peaks, which would be where the most tissue is.
Isn't that a nicer word than fat?
Yes.
Tissue.
I prefer
I
that.
like tissue.
Can we just call it tissue?
Yes, it's all tissue.
We don't have fat. We have tissue.
All right. And I just mark that with an X.
And you know, it is important, I think, always, when we're doing things to make patients look better, they want to feel better about themselves. You do sometimes have to be aware and choose your terminology such that their feelings don't get hurt or they feel bad about themselves. Because we're here to make you feel better about yourself, not to feel worse about yourself.
Absolutely.
So next what I'm going to do is just get a good pinch on her tissue to kind of see which way that it's oriented. And
Just like a deep tissue massage, right, Corinne? Just a little massage. Okay.
This also helps us identify if she's a good candidate because it must be subcutaneous fat, which we can grab, pinch, and pull. A lot of people might be thick in the girth here, but it's intra-abdominal fat, which is not amenable to this device. So I think patients need to know that that pinching is actually helping us make sure that this is fat that's accessible to the treatment and will have the fat destroyed.
That's a great point. So the fat that can be treated with CoolSculpting is the jiggly fat that we can pinch.
Exactly.
And if it's not, then it's a different type of fat.
You just have to go to the gym.
Okay.
And really and truly, people who have that intra-abdominal fat and not subcutaneous fat, I worry about those patients. I see them, and what I do is I try to refer them to an internist because those people are at risk for cardiovascular disease. This kind of subcutaneous fat is not something that would go, oh, I'm really worried about your heart. And especially when somebody is fit like she is and exercises like she does. This is subcutaneous fat. It's not going to be around tissue. It's not around her heart. It's not around her liver and things like that. So I don't get upset when someone comes to me and they're not a good candidate for this because usually what I do is transform that to a health discussion rather than a beauty discussion and tell them how important it is for them to really, they need to cut back usually on their saturated fats, their carbohydrates, and eat more lean protein and vegetables and fiber and try to lose some of that weight, you know, naturally.
So those people who you might refer to an internist, if they focus on diet and exercise and lose some of that intra-abdominal fat, could they then come back and be a CoolSculpting
those
candidate?
people usually have the excess fat in their flank, on their the love handles, maybe the back fat, rather than the abdominal. So yeah, but I usually recommend that, you know, I always put health ahead of beauty because you really can't be beautiful if you're not healthy.
Yeah.
So, you know, if someone comes to me for laser and they have acne or an active medical problem, I'm always going to address the medical problem in conjunction maybe with my laser treatments. Maybe I do that first, but at least I have to address the medical problem. We're doctors first, always, and our interest always needs to be what is the best thing for the patient.
Yeah. So you really take a more holistic approach.
Always, always. With the face, with the body, with overall health. Yes, absolutely.
Wonderful. So Stephanie, I see you're making some markings in the areas you were assessing before. What are these markings for?
It's to see where the fat tapers off,
Okay.
and then to make sure that it's going to have enough tissue for the applicator to grab because it's a vacuum suction when you apply it.
Great. So that's really the area that will be treated with the applicators is what you're saying.
Yes.
Okay,
And
great.
The greatest amount of cooling is in the center of the applicator, and it tapers off. So when you get that treatment right there, that's not a double treatment because it'll give it a more even look.
Beautiful.
So that's like the concept of sculpting, right?
Yeah.
You know, so you feather things. When we do filler, you know, we don't just put globs of it in 1 or 2 areas. There's a feathering that occurs. So this allows you to feather, and the temperature gradient allows you to not have a dip. Or a drop off. It gradually tapers, gives you a more natural appearance. One of the things that was very compelling to me about getting on board with CoolSculpting, the sophistication of the cooling and how there's a tapering effect, the shortened treatment times, the increased tolerability. I've had it myself, so I can and listen, I always tell my patients, look, I don't do anything to you that I either wouldn't do to myself or a family member, you know, or someone I love. You know, I'm not going to be doing things. I think that's a good moral compass for a physician is, you know, what would you do?
Yeah. Well, and actually, I was dying to ask you if you'd had it done, so
Of course.
you already answered
Of
that for
course.
me, which is very exciting.
In fact, I'm not sure if I bought it for my patients or if I bought it for me.
I've actually heard that before. Okay, so we have the markings done. Stephanie, what's next? Are we ready for the treatment?
Yes, she's
Okay.
ready for the treatment. I'm gonna have her sit down and relax into the chair. We're get her
All right.
comfortable, and then I'll cleanse the area with the prep wipe.
Now, Corinne, so you have, I think, how long is the treatment time, Dr. Lupo? It's roughly
Well, the actual freeze time is approximately 35 minutes.
35 minutes. Okay.
And but you know the setup time beforehand, all of this, and she's going to put the protective layer to keep the gel from getting into the machine, and the gel protects the skin. Remember, our target is the fat, so we want to protect the skin. So we want to minimize any skin trauma. Although I do tell patients it is reasonable to expect a little bit of bruising, especially if you're very fair and you're one of these people that you bruise easily. And it's kind of like a little surface we call petechial change, which is almost like a little bit of a rub burn. You know,
Okay.
if you've ever been rubbed and you
Sure.
get like little broken capillaries on the
Yeah.
surface.
You used to call it a strawberry growing up.
Yeah, it's sort of a
Or
short-
a hickey, maybe? I don't know.
Yeah, it kind of
Same
looks
thing?
like, of course,
Yeah.
that's the best analogy. It kind of looks like a hickey.
Okay.
It's very short-lived, but you will see it in most patients.
Okay.
They'll at least be red.
How long does that last, the redness?
On me, it lasted about 3 days.
Okay.
And you maybe feel a little bit like a mild sunburn sensation.
Okay.
It's the kind of thing where if you do this and you've had that treated, you might go, oh, I had my treatment yesterday. Because, you know, it's not a pain, but it's more of a sensation. Then, after the device is detached, a very important stage of treatment is the massage. And she's got magic fingers. And the massage is
artist.
very important because this breaks up the fat and allows for faster lymphatic drainage. And the massage is an integral component of the overall treatment. To me, I found that she should tell you, I was giggling like crazy because I found that it made me, I'm a little ticklish, so it's like a little bit of, you know, but has anyone ever said that it was painful for the massage?
No, not painful, but discomfort or uncomfortable.
Yeah.
Just like a pressure sensation. I found it a tickling sensation,
Yeah.
but it's certainly tolerable.
Absolutely.
Okay.
Well, it seems like whatever you're expecting, it's just nice to know what it's going to feel like, so then you know exactly what to expect, right?
I do a lot more things that hurt people than this.
So this is fairly mild. Okay, so you've cleansed the area,
Visual test.
and now we're going to
So this
protect
is the
skin.
prep wipe. This will take a minute, and I use the machine to time. But if anybody has a phone, we can time.
All right, so we're prepping the skin, and you were saying that there's a lot of things that are done prior to the treatment to protect the skin, and this is
Right.
one of them. And then you said there's a gel pad,
pad.
right? So that'll go over the skin. Now, what does the gel pad feel like, Stephanie?
It is a
cold.
goopy
Okay.
material, so that's why it's sticky.
And I think
Great.
it feels cool when you apply it.
It is a little
You
cold.
know, it's a little cool.
Wonderful.
So down here in New Orleans, that's a good thing. Okay. It's awful hot here sometimes.
I was gonna say the humidity makes it feel even
Right,
hotter.
right.
Yeah. Beautiful. So you're gonna focus on the side that's green outlined. That's gonna be your first treatment side. Wonderful. So Corinne, I'm dying to ask you, what are you planning to do during your treatment?
Well, I brought my Kindle. I'm going to get caught up on some reading.
Okay.
Yeah.
So they've told you it's so comfortable that you can just sit here and kind of do whatever you want.
Yes.
And if
Talk
you
on
get
the phone
tired,
or
could you take a
computer.
nap?
Absolutely.
Okay.
We do. We have a
All right.
computer stand for our
Yeah.
patients who bring a laptop.
Okay.
People talk on the phone. They'll use their computer. They'll read. Sometimes they'll ask for brochures on other things that we do.
Oh.
So it just sort of depends. You know, magazines, whatever.
Yeah. Can you ever do a different type of treatment at the same time as CoolSculpting, or have you ever done that?
Usually, only because of my time being so busy with the injections. And I like my patients at a certain height when I inject them. I usually don't inject my patients at the same time because we want them to be comfortable. And when I inject patients, I want me to be comfortable.
Yeah.
So we usually don't do, but we sometimes do two machines at the same time in different
Oh,
areas.
okay.
Okay. But sometimes it becomes a matter of space because
Yeah.
the machines are a little bulky.
Right.
So we have to have things that are, you know, you could probably do micro needling because that's a small machine,
Okay.
not bulky.
Yeah.
So it's really a matter of logistics.
Yeah. So if I didn't have a lot of time, I could either get 2 treatments of CoolSculpting at the same time with 2 machines, or I could get even another procedure if I wanted
Yeah,
to.
you could. I mean, we'd have
to
to
know.
specially schedule it that way, but it's not
Right.
impossible.
Okay.
We
All
aim
right.
to please, as they say.
I love it. Count me in. All right, Stephanie, what's next?
Next, I'll turn on the machine, let it boot up, and then we'll place the applicator on top of the gel pen.
Okay, wonderful.
Now, this is when it'll get noisier.
Yeah. All right, for those watching out there, I want to see some blue hearts.
Or at least some sympathy.
Keep
I'm
those
excited.
questions coming.
I'm excited.
And before we begin, we didn't show this, but we do extensive photography, standardized photography.
Oh, that's a great point.
We'll weigh and measure our patients so that we can make sure that they're not leaving their CoolSculpting and going to Haagen-Dazs.
Yeah. Right.
You know, I mean, we can't do this alone. We need the patient to help us.
Yeah, so post-treatment, you recommend they keep doing their active
Absolutely.
lifestyle, their diet
Okay.
and exercise.
I exercised that night when I had it done. So it's just, you know, and this is not just true with CoolSculpting. This is with a patient who wants to look younger. You know, you can't come in and get injections a couple of times a year and not use your sunscreens and not use your dedicated skin products that we recommend. You know, it's a holistic thing with everything in life that we do. If you exercise, you don't just go to a spa for a week, exercise, eat right, lose 5 pounds, and then come home and go, okay, I'm good.
Yeah.
You know, you go,
Yeah.
you know you need to maintain.
That's right. So this is really part of a maintenance plan.
Absolutely,
And complements an
absolutely.
already healthy lifestyle that
Absolutely.
you clearly have.
Absolutely. And
Yeah.
I think that, you know, when people, patients, whatever, understand that they have the ultimate responsibility for their health and for their appearance, and they're on board and not just passively going, fix me, doctor, they'll get a much better result. And
Yeah.
it'll be maintained for a longer period of time.
Yeah.
I mean, I tell my patients all the time, look, I can turn the clock back, but it's going to keep ticking.
Right.
The
That's
only
a
way
great
to have
analogy.
the only way to have a permanent facelift is to die the next day. Because we keep aging.
Yeah.
So it's with anything we do. So,
You can't stop time.
you know, I think we
That's right.
live in too much of a society of, you know, well, I want it now and I want you to do it for me.
Yeah. Well, and speaking of time, how long does it take to see results?
That's a great question. So most people begin to see something at about 3 weeks, but the maximum result is at 3 months.
Okay.
And the reason for that is we're triggering the death of the lipocytes, of the fat cells, with the sub-zero temperature. So we're freezing them. It's called cryolipolysis, which is short for freezing to destroy the fat cells.
Okay.
Okay?
Great.
And so the process of cell death is not instantaneous. It happens over time. But that fat cell, once destroyed, is gone for good.
Wow.
Okay? And if one gains enough weight you will get the fat cells that remain will hypertrophy and they'll get bigger. But the ones that are destroyed with the cryolipolysis from CoolSculpting are gone for good.
Wow, that's great to know. Okay, so let's see a little bit about how it feels when you put the applicator on. So Stephanie, you've just turned on the vacuum.
Correct. And I put the strap behind her so it's
Okay.
comfortable for her. And then I'm just going to go directly on with the applicator.
All right,
line it
Corinne,
up
here
with
we
the lines
go.
that we made.
Here we go.
Excited. That be gone.
All right, so I saw it right up in there.
Yeah, it goes right in there. So one of the things that we did this holiday season to motivate our patients is everyone who got a CoolSculpting was put in for a drawing for a Fitbit.
Ooh, what a great idea.
And because we want to continue the messaging that it's on you to maintain what we're doing.
That is an excellent idea. I love that. So in order to be in the drawing, I get a treatment, and then I get the Fitbit right away?
Patients, yes.
Oh,
yes.
cool.
Drawings September, October, November, December.
Wow. Very
And
exciting.
we'll see if we'll continue it. I have to decide. I might do something different.
Yeah,
Just to
I love
keep-
that idea.
just to
So,
change things up a little
holiday
bit.
promotions. So Corinne, how are you feeling?
I'm feeling good. I like
Okay.
the way the pad that she put on.
Mhm.
That just had a very soothing feel to it.
Wonderful.
And then we have pillows, and we'll
I
prop
mean,
them up.
This
and
is the lap
this
of
is
luxury here.
Wait. This is a lot better than flying coach. Okay.
I would say, well, you
First
certainly.
class all the way.
This is definitely more than 2 inches reclined, so I'll take that any day.
Yeah, we want them to be comfortable,
Do you want a blanket?
Thank you.
Fantastic.
and we'll usually dim the lights.
Yeah. Yeah.
And then people, unless they want the lights for the reading, but if they have
Sure.
their Kindle, they can.
So you can see your Kindle better.
Mhm.
Yeah.
And are you
Beautiful.
comfortable?
I'm
Ready for
very
me to start?
comfortable, yes.
Okay.
She's a trooper.
So you've started
Body
the
by
treatment.
Lupo.
All right.
And so you'll start to feel the cold.
Okay. Feels a little cold. Not bad, but uncomfortable.
So
Yeah,
when
it-
it's getting cold, how long does it take? I've heard that it kind of goes numb after a while. About how long does that take?
I tell them minute 1 to 3 you're gonna feel cold. Minute 3 to 5 you'll go through this cold burning phase, and then you'll go numb for the rest of the procedure.
Okay.
And as in cold burning, it's like if you stick your hand in an ice chest, and then all of a sudden your hand goes numb. Or if you have a sports injury, you ice your shoulder, and then it goes numb. That's the cold burn that we're talking about.
Sounds good. So kind of like putting an ice pack, or
A really
taking
cold
an
ice
bath.
pack.
Really cold ice
A
pack.
really cold ice pack.
Beautiful. So after a few minutes, you'll be completely numb, basically, and then you can get your Kindle.
Yeah, it's right there.
Yeah, but it's not bad. I mean, it doesn't feel uncomfortable at all.
Well, you can see by her face. She's
Yeah,
perfectly at ease.
Yeah.
She's still jabbering with us full
Yeah.
speed.
Yeah.
If Corinna is not talking to me, then I'll know something is
Right.
wrong. We New Orleans girls talk
That's
a
right.
lot, don't we?
Yes, we do. Yes, we do.
How to keep the conversation going. All right, so you have about a little over 30 minutes left in your treatment time. So typically, do you stay in the room or do you kind of move on to other things?
I'll stay until the patient tells me that they're
Okay, great. So why don't we go check on our next patient?
All right.
We will see you soon.
I'll be here.
Alrighty.
Thank you.
All right, everyone, follow us into the next room to see a live treatment. So we're gonna go check on the
Yes,
patient.
let's go.
Let's go.
No, the pillow.
See you later, Corinne.
Yeah, all right, bye-bye.
Bye, darling. Hello, Linda. How's it going?
Fine, Dr. Lupo. How are you?
I'm good. How about you?
Fine.
Okay, good. Linda, this is Rachel.
Hello, Rachel.
We're
Hi,
talking
Linda.
all things CoolSculpting today.
Yes. It's
I'm learning so much about Dr. Lupo's practice, so it's so nice to meet you and see how relaxed you are in the middle of your treatment.
absolutely. Yes.
And it looks like you're getting your abdomen treated today. Is that
Absolutely,
correct?
yes.
Okay. Wonderful. So what's your story? What brought you in to do CoolSculpting here?
Well, I had my back isn't very good.
Okay, so you have a
and I
bad
had-
back. Okay.
Yes. And I couldn't do the exercises for my stomach, and it was growing.
Yeah. Well, and how many of us struggle from injuries and we can't get to the gym and then we
Absolutely.
become it becomes a problem for us.
And
But you're
she's not heavy.
No, you're an
she's
otherwise
not heavy.
active
She just-
person.
It's just all,
Yeah.
yeah, I carry my weight in my stomach, and
Yeah.
this was just a wonderful idea. you
Yeah.
know. The treatment is well worth it.
Wonderful. Wonderful. So you're having your abdomen treated now.
Yes.
But Dr. Lupo, how many areas can be treated with CoolSculpting?
Well, that's one of the nice things about it is the versatility. You can treat everything from sort of your knees to your chin.
Oh,
You can do the
okay.
little fat pocket above the knee. You can do that little banana roll underneath your buttock. You can do your saddlebags, that little
Wow.
bulge in between your thighs. Of course,
Okay.
you can do your lower abdomen, your upper abdomen, your love handles, your flanks on the side.
Wow. What about bra fat?
Bra fat is very
Okay.
popular, especially with postmenopausal women. It seems like you think you look good, and then you turn around and you go, who's that? You know? So it's the back fat, and then the submental chin fat.
So that's a lot of areas. So
It really is
from
very versatile.
The chin to the knees, the thigh gap, inner thighs, we've got the bra fat. These are so many of the top areas. Yeah.
Oh, look, she's being beeped. That means her
Oh.
treatment is about done. So we'll get
How
to
much
see the
more
end
time
of
do
it.
we have, Stephanie?
Just under 3 minutes.
Under 3 minutes.
So that's so that we can be alerted, so we can get everything all ready. So that we've got all of our ducks in a row. We've got the pillows removed.
Wonderful.
And so we can do the massage portion.
Wonderful. Okay. So as we get ready for the massage, I just want to remind all of our live audience out there to write in with your questions via email, in the comments. There are specialists standing by, ready to answer all of your questions as soon as possible. And of course, we are going to have some questions at the end, which we'll throw out to Dr. Lupo and myself to make sure that you have all the information you need to make a good decision about getting a CoolSculpting treatment. Okay. So the countdown begins. We have a couple minutes left. Now, let's say, because I noticed that you had left the room and Linda was in here by herself before we came in. Now, Linda, what if, I know I'm thinking about myself here. If I'm getting my treatment done and I'm probably on my cell phone, what if you dropped your cell phone? How could you get a hold of Stephanie? Is there a way to do that? Do you have like
We
a,
have the beepers. Yes.
okay. Oh, so you have a call
Red
button.
little call button, and it
Okay.
beeps me, and then I'll come back to them.
Okay, that's good. I'm just making sure we have a way to get a hold of you, Stephanie.
Yes.
Okay. All right. So the straps are coming off.
And I'll just hold it in place for the last minute.
Okay. So you hold it in place and get you ready. And this is the time when you're going to prepare Linda for what's about to happen now. And you were mentioning the massage.
Yes.
Now we're going to get to see it close up, which is very exciting. Now, why is it that we do the massage again?
Well, it helps to mobilize the fat that's been released from the damaged fat cells.
Okay.
It also helps relieve some of that firmness that you're going to have and has the tissue lie back down flat because it's
Okay.
kind of raised up. You'll see it in a
Okay.
second, and it's like a little block of frozen tissue.
Okay. We've
So-
got a frozen brick. All
And the
right.
massage is very important because it improves the lymphatic drainage of the fat and softens the whole area.
Okay. Okay.
She does it so fast.
I know. I can't wait to see
She's
this.
like a world-class typist, the way she does it. And it's like, oh. It's the best way I can describe
And
it.
it's just 2 minutes, you said?
It's 2 minutes, but what I really do is take it off, which I'm gonna do.
Here we go.
Here we go.
We're going.
And then she has the jump pad on, which
It's a little bit raised,
Uh-huh.
and it's a little red.
because of the cold.
Okay.
And it's going to be firm, and she's
Okay.
going to...
And then
All right. Oh, I see what you mean.
Mm-hmm.
She has the fingers and the.
How does that feel? Feels good.
It feels good. You said.
Yeah,
Oh, wow.
my
Okay.
area was the side, and
Okay.
that was more ticklish, I think,
Yeah.
than the abdomen is.
Oh.
I think some areas are a little bit more ticklish than others.
I think it's like we're all different, right? Like we
Oh,
all
yeah.
have our little tickle points. I know for me it's my feet, and like some people have their abdomen. Yeah. Oh, cool. So, how is it feeling now? Is anything changed? Still feels the
No,
same?
Still feels good.
Okay.
Yes.
Okay.
It's lovely.
Yeah. So the redness that we see here, Stephanie, how long do we anticipate that will remain?
typically by the time I do the other side, this is back to normal tissue.
Okay, so it doesn't last very long at all. Okay. Very interesting. Okay.
Yeah.
All right, so we're getting ready for the other side. Okay. Oh, you know what? It looks like we have a question from our audience. So
Peggy.
while this has been going on, Peggy. Okay. So Peggy is asking, how much does Cool cost?
It is very variable depending upon how many cycles the patient needs, what their goal is. You know,
Okay.
we always discuss with the patient, what is it you wish to achieve? Now, what we a typical area, you know, a good ballpark is say $2,000 to $4,000.
Okay.
And when you consider the long-term benefit that you get, it's well worth it.
Excellent. Yeah. So it is, you know, one of the best, as you've chosen, non-surgical options for
Absolutely.
fat reduction. So when you talk about patient goals, and I want to go back to Peggy's question, so I understand that it's variable based on the goals.
Right.
So if I'm getting, and I see that the markings here on the upper abdomen, there's 2 treatments up top, and it looks like she might do 2 treatments on bottom. So that's a pretty average number of treatments for
I
an
would
area.
say absolutely. Four to 6 is a typical. It depends on the volume of fat because with each treatment you're losing somewhere around 20 to 25% of the fat cells.
Got it.
So if you only have a little bit, you know, we measure. We do weight, and we do photography, and we do linear measurements to monitor. And, you know, although we monitor the weight, you know, we emphasize to patients that we mentioned earlier, this is not a weight loss device.
Right.
Because if anything, fat doesn't weigh as much as muscle. And if you get rid of fat and you're working out, you may build muscle, your weight may not change at all.
Right.
But what we caution patients is remember that if you gain a substantial amount of weight, it's going to be in the form of fat because you're storing those increased calories.
Okay.
And it's got to go somewhere.
Yeah.
So you really need to use this as a sculpting technique and at least maintain your weight. Or if you gain weight, you know, have it be just 5 pounds here and there. You know, it's not substantial.
Normal fluctuation.
Yeah, those normal fluctuations we all get at the holiday time.
The holidays are coming up.
Yes, and then here in New Orleans, then we have Mardi Gras, and we have those doggone king cakes running around, okay? It's like, oh my God.
So limit the king cakes. Got it. And if you lose weight after CoolSculpting, what could happen then?
Then that's only good.
It's only going to get better.
That's only good. I mean, you know, and we often find that when you start a process like CoolSculpting, patients are motivated and they become a little bit better about their diet because it's almost like they've made an investment. It's like when I do filler on a patient, they will suddenly start wearing their sunscreens and using their retinoids at night because they want to maintain. We jokingly sometimes call it, this is your homework. We do an assignment and then we give you some homework.
Yeah.
So her homework is to make sure she does her best to watch her diet, and we don't ever ask a patient to lose weight. We don't ask them to do that because we don't want people to think that they have to lose weight for CoolSculpting to work because they don't.
Correct.
Okay? But the flip side of that is we don't want them to gain weight.
Right.
So that they can have optimal body sculpting.
Yeah. Beautiful.
Right.
All right.
So we have another question from Carolyn.
Carolyn, okay. Carolyn's wondering, how does CoolSculpting actually work?
Well, it's very simple. It works because it induces cryolipolysis.
Okay.
Cryolipolysis is when you freeze the cells to the point where they're damaged, and it triggers something called apoptosis, which is programmed cellular death.
Okay.
Sounds horrible, but we want those fat cells gone, okay?
That's right. So once they're gone,
They're gone.
they don't come back.
They do not come back.
They're gone for
Fat
good.
cells that are there that haven't been destroyed can hypertrophy when you gain more weight, if you gain more weight.
Yeah.
But fat cells that are destroyed aren't regenerated.
Right.
That's what's the
Okay.
important concept.
Okay. Very interesting. Oh, we have one more. Ooh, this is a good one. So Mary is wondering, are there any side effects? So post-treatment, so Linda goes home and she sees her results probably in the next few months is what she's going to say, right? So what can Linda expect to feel?
Okay, so it's normal to have a little bit of redness or petechial bruising.
Okay.
That can happen. Not everyone gets it, but some people
All right.
do. much the same way as it's expected that when a person gets filler, they're going to have some swelling, maybe some bruising. Okay?
But it's temporary.
It's temporary,
And it
it's
goes
self-limiting, it does not require treatment.
Okay.
Some people experience a little bit of prolonged numbness or tingling.
So side effects in variation that you just mentioned, some numbness, some tingling, a little bit of
Exactly.
soreness. It really lasts between days to a few weeks.
At the most, you know, maybe 3 days.
And then
I had a little bit of bruising. I think it was there for 3 days. I had a little bit of sensation, almost felt like a mild sunburn.
okay,
That lasted for maybe a day or two.
that's pretty tolerable.
I mean, and I worked out the same day. I worked the next day.
yeah.
Yeah.
It sounds like
can't-
there's
the problem
no
is I
downtime.
can't get on the machine. The cobbler's children have no shoes. Okay.
But you did have one treatment.
Two.
Oh, you had two
Well, I have
treatments.
two sides.
Two areas,
You know,
right?
2 areas.
Okay.
Yes.
And the difference between, you know, one treatment versus two can be really just
You
up
can
to the
do.
patient.
Sometimes you can do them the same day.
Yeah.
Depending on the where you go, sometimes it can be done at the same time, depending on the area.
Wonderful.
And it depends on how much time you can devote to it.
Yeah.
I mean, we literally have had patients that have said, I want to be there for 3-6 hours or whatever.
Yeah, so it really is up to the patient. And
It
whether
really
you
is.
want to look better and feel better in your clothes or perhaps out of your clothes might determine what your goals are.
That requires
Right?
more treatment.
That requires more treatment. So if you have a beach vacation coming up, everyone, you might need maybe more than one treatment. Okay. All right, so thank you guys for all of your questions that were submitted. We have more. Oh, Jacob, sorry, we have a few more, Dr. Lupo. Jacob says, how can I find a provider in my area? Okay, well, I'll take that one. Go to CoolSculpting.com. There's a physician locator there to find a provider near you.
Based on zip code, I believe.
That's correct. So based on radius, zip code. Okay. Oh, Claudia, this is a really common one. So what happens to the fat? We talked about it freezes. You talked about cryolipolysis, apoptosis, all these things. But what does that all mean? Like, where does it actually go?
The fat is cleared through the lymphatic system of your
Okay.
body.
So
the
lymphatic through the liver and
then out
eliminated.
through the urine.
Got it. Through the urine. Pretty simple, guys. Okay. Derek wants to know, can I treat anywhere on my body?
That's a very vague question.
So let's just review.
Yeah.
What are all the areas that can be treated with CoolSculpting? Okay.
under the fold of the buttock.
Okay.
This is especially common with women.
I heard that's called the banana
the
roll.
banana
It's
roll.
right
yes,
under
yes,
the
yes.
okay.
The saddlebags, which are
Saddle-
the areas
outer
on
thighs.
sides, the inner thighs.
Inner thighs, thigh gap. Anyone looking for a thigh gap?
The flank, as well as the love handle is technically above the waist,
above
and
the
those
waist.
flanks are sort of below the
Okay.
waist.
Yeah.
That little chunky area there.
Right. And the double chin. Okay.
Okay.
Great question,
So we
Derek.
don't treat the ankles. We don't treat the forearms.
Okay.
You know, and the
Wonderful.
amount of treatments, I think we got a question on that.
Oh.
The amount of treatments that are
Renee,
needed
yeah.
depend on the volume of fat. I mean,
Gotcha.
some people just need one cycle to an area.
Okay.
Some people need at least 2. So
Right.
it really depends. That's
So if
what,
I need more than one treatment in one area, how soon do I come back to see
no
you?
sooner than 30. If we know ahead of time,
Mm-hmm.
we tell people, look, you're going to need 2 cycles to
Okay.
this area. You can do it as soon as 30 days.
Okay.
But remember, you don't have your final result for about 3 months.
Mm-hmm.
So if we're not sure, if we go, well, we might be able to get this with one, and we want to have greatest economy with your
Yes.
cycles, then we might wait the 3 months.
Okay. So it really depends on the goals, it sounds
Exactly.
like. And
The
if I have more
severity, the
volume-
goals, yes.
Exactly.
yes.
So less volume, maybe fewer treatments, more volume, possibly more. But it really comes down to
Right.
what do I want to achieve as a patient, which
That's
is
why
exciting.
it's best. The ideal candidate is someone who doesn't have, over 30 pounds
Yeah.
of excess fat on them.
Absolutely.
That it's not realistic. Although, as I've seen, I have people who insist. And they come back and say things like, well, I lost those 2 inches and I'm flatter here. And so I'm eating better. I'm going to the gym more because I feel better about myself.
Yeah,
It's
of
almost
course.
like I get that feeling of, okay, I deserve this.
It's like and you've made an investment. So it's like, how do I protect
Exactly.
my investment, right? Absolutely. So, Dr. Lupo, we cannot thank you enough.
It was my
for
pleasure. I'm so glad you
allowing
could
us
come and
into
visit.
your practice.
I love your little snowflake earrings.
Holidays. So thank you. So we got a peek behind the curtain here. Stephanie, you're clearly an artist here.
Yes, she is.
Sculpting bodies here at the Lupo Center. And thanks again for joining us live, everyone. So we hope you had just as much fun as we did.
We did have fun. Happy holidays.
Yes, exactly. So hope you learned a little bit more about CoolSculpting, the global leader in non-surgical fat reduction. I guess see you soon, hopefully. Stay cool.